Welcome back to the 2020 PQA Leadership Summit. I'm Richard Schmitz, PQA's Senior Director of Communications. Our next two speakers will address the types of SDOH interventions that can improve the quality of medication use and where pharmacists are best positioned to provide screening, evaluation, and services. We'll start with a pharmacist perspective and how pharmacies are integrating SDOH into their workflows. Then, we'll hear why SDOH is important for health payers and how pharmacies are being leveraged in their SDOH programs. First up is Jill Regan. Jill is a Director of Relationship Management at LexisNexis Risk Solutions. Our second speaker is Lilian Ndehi. Lilian is Humana's Associate Vice President for Patient Safety and Pharmacy Stars. After their presentations, both will join us live to answer your questions. Please share your thoughts on the issues and send us your questions in the box below. Let's hear from them now.
Thank you for joining today's session on promising practices to address social determinants of health through Pharmacist Provided Care. My name's Jill Regan. I am a registered pharmacist, and I have experience in working in retail pharmacy for over 25 years. Not only did I provide diabetes-related services when I was a pharmacist working behind the counter, but I also was able to provide pharmacy-related services outside of the pharmacy, not only by appointment, but through other vehicles. In my previous role as a pharmacy district manager, I know the importance of not only filling prescriptions efficiently and profitably while focusing on patient care, giving immunizations and screenings, and most importantly, ensuring patient safety. Today, we're tasked with prioritizing areas of focus where we as pharmacists can do more and improve the quality of medication adherence. Socio-determinants of health has been around for many years and is an increasingly growing buzz in healthcare. A pharmacist has the most recent access and interaction with patients, and there are many things that we can do to not only impact patient adherence, but also to improve their overall health outcomes. Prior to COVID-19, we already were aware that chronic conditions were driving majority of our healthcare costs. According to fightingchronicdisease.org, in 2020, 48.8% of the American population will have at least one chronic medical condition. As outlined on the right-hand side of this slide, some of the chronic conditions that you are already aware of, you probably already have programs in place to address. It's in the middle of the slide where we have a sense of urgency. Chronic conditions are the cause of 7 out of 10 deaths in the United States. 81% of hospital admissions and 91% of prescriptions filled are due to chronic medical conditions. We also know that 76% of all physician visits are a result of patients with chronic conditions. Now, these people are the ones we need to focus on because they can't postpone their health, and we need to have some type of an effect to improve not only their overall health outcomes, but their medication adherence. So we as pharmacists play a critical role. Studies have shown that by April of this year, office visits were down at least 60% compared to last year. And even now, they're down 30% compared to last year. Americans are just avoiding physicians' offices, clinics, and hospitals. And we also know that telehealth visits are on the rise. The people with chronic medical conditions simply know that this is negatively impacting their health. We also know that COVID-19 has not only impacted patients' socioeconomic status, but people are now concerned with their financial stability, their unemployment opportunities, as well as losing their health insurance. So that's the bad news. The good news is that in May of this year, the Alliance for Community Health Plans did a poll and determined that the pandemic has not greatly impacted in-person visits to the pharmacy. In fact, over 90% of respondents that had received new medication did so from their local pharmacy. Additionally, 90% of Americans do live within 5 miles of a pharmacy, and patients with chronic medical conditions have 35 or more visits in a given year to the pharmacy. So this means that pharmacists and pharmacies are poised to serve the critical needs that we have in the US, with being the trusted and safe center for patients avoiding physicians' offices and for us to identify and improve their medication adherence. Predictions can be highly useful on medication adherence and motivation. So for adherence measures, we're really trying to predict not just who might not get their prescriptions filled, but also to gain insight into why they won't get them filled. The understanding of why is critical if we're going to align our services to improve our patients' adherence rates. In order to mitigate risk associated with patients not coming in or being out of compliance, social determinants of health can be matched to social and community services. So take, for instance, if a pharmacy has a patient who's socially isolated and lacking transportation, the pharmacy can then target that particular individual for possible medication delivery, or maybe a ride share, either to come in and pick up their prescriptions or possibly to get them to their physician's appointments. We know that Lyft offers rides for Medicaid eligible patients in 23 states in order to get them either to the pharmacy or to their physician's visits. But we also know that Uber and Lyft have partnered with NimbleRx for prescription delivery. So these are services that, as pharmacists, once we identify them, we're able to refer and get patients into these services in order for them to be more medication adherent. Another study shows that 68% of patients reported that they had at least one socioeconomic challenge that would impact their medication adherence. These might be things like financial insecurity, food and housing insecurity, where they're trying to make decisions on whether they can pay their bills and feed their families versus getting their medications filled. These also might be things such as health literacy. So pharmacists, for patients who have been identified as having issues with paying for their medications, pharmacists are very well poised to recommend drug discount programs where applicable. There also might be able to provide promotion of financial services for patients who might need more of the supplemental security income Medicaid versus the temporary assistance for needy family Medicaid. So it would be an opportunity for a pharmacist to recommend these types of financial services when identified. Another area might be patients who have a barrier with health literacy. An opportunity might be to embed a barcode or something in a monograph so that the patient can then download a video and be able to understand a little bit better how to take their medication and what their medication might be for. Predictive modeling, data, and analytics can really help pharmacists and organizations identify the types of barriers that a patient might be facing with their medication adherence. And they're very poised today as pharmacists to be able to identify these opportunities. But let's face it, the challenge today in pharmacy is that resources need to be allocated to performing these analytics and putting that information right in front of the pharmacist in real time so that the barriers can be addressed at the time that the pharmacist is filling or dispensing that prescription. We know that pharmacists are frontline workers. We appreciate them, and so do their patients. But at the same time, they're very busy. And so there need to be additional resources that are available to them to help identify these barriers. Let's take a look at how predictive scoring and modeling based on socio-determinants of health can be utilized in the pharmacy workflow to help improve medication adherence. These types of scores and alerts can be provided right in the pharmacist workflow as they're filling a prescription. If we take a look at this slide, we have 4 patients. On the surface, they all look the same and as far as medication adherence. We might not know anything different about each individual. They're all male, they're all approximately 55 years old, and they've been prescribed medication to treat the same medical condition. Now, studies have shown that 20 to 30% of prescriptions are never filled, and 50% of medications are for chronic diseases that are not taken as prescribed. So it's really important to understand not only these statistics, but for the pharmacist to understand of these 4 individuals, who's most likely to not be adherent? Who can we do something to prevent their non-adherence? But more importantly, why potentially are they non-adherent? When we implement predictive scoring in the pharmacy management system, the medication adherence score can be presented right there for the pharmacist. So if we take a look at these 4 individuals and what information we know about their social determinants of health, this would be better able to assist a pharmacist into identifying what opportunities and what resources they might be best to align with that particular individual. So let's take a look at Jack. Jack on the left-hand side of our screen, he's about 20% likely to be to adhere to his medications. Some of the barriers that Jack faces are the fact that he's seen a decrease in his financial income over the past year. He's also has minimum banking experience. So by providing this information to a pharmacist might be able to recommend some financial assistance for Jack. They might also be able to recommend some drug discount programs that Jack might be able to take advantage of. Because let's face it, with a reduced income, Jack is struggling to find the opportunity to pay his medical bills, his utility bills, as well as his medication. If we take a look at Manny and Will, they're also a little bit more less likely to be to adhere to their medications. Manny lives in a high crime neighborhood. He's also been involved recently in a car accident. So a pharmacist, knowing this information about Manny, might be able to recommend transportation. So maybe a rideshare program, so Manny could come in to pick up his medications, or might align Manny with some type of medication delivery program. If we take a look at Will has some different struggles. Now, Will is a little bit more likely than Jack or Manny to adhere to his medication protocol, but he doesn't live near a relative. His nearest relative lives over 100 miles away. So studies have shown that patients who have a relative or an associate that lives more than 25 miles away are less likely to adhere to their medications. So Will is also socially isolated. So we might want to recommend some support groups. The pharmacist might need to check in more frequently with Will. And we might also recommend medication delivery or possibly rideshare programs so Will can come in and pick up his medications if he has no one available to bring him to the pharmacy. And then finally, we have Chen. Now, Chen is 90% likely. So on the surface, these 4 individuals do look like they would be adhere to their medications, but at the same time, if you get deeper under the surface, you'll see that there's other things going on that might preclude them from being adherent to their medications. Utilizing social determinants of health insights, we as pharmacists and PBMs can better partner with our community resources, or in fact, build in-house programs that can address these types of needs that we see with various patients. So to wrap things up, pharmacists really can play an active role in community health efforts. We can allocate resources and time to those who need our support the most. We could be educating patients and counseling patients, but also helping to solve for transportation, financial issues, or other challenges that we've identified or have been identified by social determinants of health. Predictive analytics really can provide guidance on those fronts for each individual patient. At the corporate level or plan level, you can use social determinants of health insights to help segment your patient population into groups based on risk, identifying frequency and density of health barriers within those segments. You can then make decisions about programming and resource allocations across maybe your regions, your districts, and even at the local store level, so that you can address varying needs by patient to help better understand the risk within your population. With an understanding of each individual's social determinants of health, the local pharmacist really can help at-risk patients become more adherent with their medications. It's not just about asking questions and providing counseling information on particular medications, but it's digging deeper to identify social influencers that might be affecting that particular patient's adherence. So, for example, asking questions of a patient about transportation issues that keep them from coming into the pharmacy might improve the ability to refer patients to various resources. As a pharmacist, then we have a more holistic view of a patient that can not just their medical or claims history, that can really help us focus a little bit more on improving the quality and health for each and every patient. We all know that medication adherence really does cost the US about $100 to $400 billion a year. So this is a lot of potential savings in other medical related costs that we can have an impact on, not to mention the potential revenue in our pharmacies as patients continue to fill and receive medications that they're prescribed. We know that there's other services outside those that I've mentioned, such as 24-hour live chats, customized daily medication packaging, wellness programs. There's a large variety. You can have self-training kiosks in your pharmacy. You can have self-tracking devices on activity levels, depending on what the patient's needs are to meet their needs, not only with medication adherence, but overall services to improve their health. So in conclusion, as the pharmacy industry continues to shift to more value-based care contracts, social determinants of health can really provide that much-needed view of what challenges each and every patients are facing in order to achieve their medication adherence and overall optimal health. Using these social determinants of health can create community resource programs, allocate resources across your pharmacies or your regions, and help build a more loyal customer base, because we know that patients not only appreciate their health plan, but more importantly, appreciate their pharmacist for giving them that personalized care. I hope I've given you a lot to think about. I look forward to your questions, and I thank you for your time today.
Good morning. My name is Lilian Ndehi, and I lead the Patient Safety and Pharmacy Stars organization at Humana. And we are responsible for the development of pharmacy programs with the goal of improving clinical quality and outcomes. And this includes medication safety and adherence. I also oversee Humana's quality network, where we are focused on developing innovative clinical programs in partnership with pharmacists that showcases the importance of holistic management of our members and improving health outcomes. This is why I'm honestly excited to be here today to talk to you about the opportunities for pharmacists to address social determinants of health, factors that are known to have negative health impacts and are critical to address in order to improve medication use and health outcomes. So today I'll be talking to you about social determinants of health impacts, insights, strategies for pharmacist provided care, and I'll also be reviewing 2 pharmacist provided care pilots that we've either completed or currently underway. So we know that the reasons why patients do not take the medications as prescribed is complicated, and it's usually entangled with unmet social needs, such as food insecurity or housing instability. I thought it would be important to start with a human care success story that reminds us the role we play in delivering quality experience in partnership with our clinicians as our way to improve health outcomes and advance the care of our members. One of our pharmacists identified a 70-year-old Medicare member who was non-adherent to her chronic medications and was from a low-income household. And when they talked to her, she expressed high levels of stress, had financial strain, and had poor housing quality that needed repairs. The pharmacist refers the member to a local home repair service that provides services for elderly and disabled low-income homeowners. The member was very grateful for both the screening and the referral. And this is what she said. I wasn't prepared for anybody to call me because I was never able to be successful. So I was going in around in circles, wondering what to do and how to do. I appreciate you calling. I was thinking I'd have to give up my house, but I didn't know what else to do. My house is my independence. You sure made my day good. You gave me hope, something I didn't know still existed. I don't know about you, but when I read this, it again really emphasized the role that we can play in really partnering with our members to help treat those social needs so that they can be able to improve their medication use. So that to me is such a great story, again, that tells us what we can do for our role for the social determinants of health. So why are organizations such as PQA, Humana, and other organizations putting a lot of focus on social determinants of health? So we know that 60% of health is impacted by behavioral, environmental, and social conditions. The 2018 Consumer Perspective Report revealed that 68% of the Americans surveyed identified having challenges in at least one social determinant of health risk category. So I'll let that sink in. 68%. I found that very, very interesting. We also know that health-related social needs are associated with worse health outcomes and have an impact on medication access, adherence, as well as health outcomes. What this data shows is that barriers outside of the clinical setting, like healthy food, can negatively impact a patient's health, and addressing these needs in patients is critical to improving in an individual's overall health. So one of the things that we knew was going to be extremely important was that it was critical that we understood our members' comprehensive social needs so that we could identify areas of actionable opportunities so as to improve their health outcomes. And what we ended up doing was that we conducted a multi-channel survey from October 2019 through February 2020, and we used a nationally representative sample of Medicare Advantage members as well as Florida Medicaid beneficiaries. There are a few things that I'd like to highlight on this slide. The most prevalent social determinants of health are financial strain, food insecurity, and social isolation or loneliness. And this was consistent for both Medicare and Medicaid members. What I'd also like to point out is that every social determinant of health listed here can have an impact on medication access or adherence. So for example, if a patient has financial strain, they may not fill their prescription or they may choose to skip doses. If they have food insecurity, they have the option of choosing to buy food or buying medications. Members that are found to be lonely or socially isolated usually have lower adherence. And if they do not have transportation, they may be unable to pick up their prescription at the pharmacy or go to their physician to get a prescription. Housing insecurity or utility issues also may impact a patient's ability to properly store the medications. For example, those medications that need to be refrigerated. I think this highlights the importance as pharmacists to address these needs so that we can be able to improve medication access as well as health outcomes. So when we think about how we can best leverage pharmacists in addressing social determinants of health with our members, there's several things to take into consideration in order for us to have meaningful and impactful solutions. So I'd like to start by discussing the social determinants of health care continuum, which really shows the different steps we need to really think through to engage our members. This is usually initiated by identifying patients that would benefit from an outreach, and this could be identified through predictive analytics or risk mapping. The next step would be to outreach the patient so as to perform the social determinant of health screening, collect the data, as well as identify the resource that is available in the patient's community. The pharmacist would then provide the resource referral based on the identified social need. So for example, if a member says they had food insecurity, that may be an opportunity to refer them to a food pantry. And of course, the goal here would be for the member to receive treatment for the identified social need, which will allow them to better take their medications. This would then be followed up by asking or following up with the patient to address the outcomes of the resource referral. So for example, you'd ask them, did they use the service? Or was it easy to contact the resource? We also recommend measuring the impact of the intervention. So a great example would be, did the service help meet the patient's needs? Did the resources that you refer them to have enough capacity? Were there any improvements in outcomes, whether it's medication adherence improvement or greater healthy days? Also, we know that these factors are changing constantly. So we would recommend that one should consider evaluating these factors frequently. We realize that in order for us to have a sustainable model for pharmacist provided care, certain factors are needed. And one would be social determinant of health data infrastructure, which would include having a standardized format for collecting data, as well as having technology that would allow use and the exchange of data. So for example, if you collect data that a member is food insecurity, being able to immediately communicate that to the payer would be something that would be extremely beneficial, or even communicating that to that patient's physician. Something else that's also critical, because again, population health is local, is that community engagement is important. And this includes the business leaders, the local government, or nonprofit organizations. And these are the ones that either support or manage the community resources needed to treat the social needs. We also need to deliver evidence-based scalable solutions. And right now, how we're doing that is through performing pilots to measure impacts of interventions on outcomes. So some of the things that we're doing would be including measuring medication adherence lifts, greater healthy days, seeing if the members or patients have a lower A1C, or if they have lower inpatient admissions, among others. What we're also doing is partnering with key partners to have this social determinants of health discussion or continuum as part of their workflow. I think the other important factor that we've realized just based on our pilots and discussions is the importance of pharmacist preparedness. We realize that this is generally not part of the traditional practice of discussing medications. What we can tell you is that we have seen that some pharmacists make meaningful impact to help members address the social determinants of health. And we would really like to see greater receptivity across pharmacies so that we can continue to impact these factors that, as we know or we've discussed, have an impact on medication access. They have an impact on medication adherence. They have an impact on health outcomes, things that I know we're interested in influencing and having a positive impact. So as mentioned in my introduction, one of the areas that I focus on is really looking for those areas where pharmacists can be able to provide holistic management so that we can continue to demonstrate our value in improving member health. And one key area is how we can be able to work with our members and work with our communities in addressing social determinants of health. So we have implemented some pilots, and I'll be discussing two today that I'm extremely excited about because I truly believe it shows the value that we bring in helping our patients. The first pilot was implemented to understand how we could tackle the social needs through the community pharmacy. And we targeted Medicare members that were non-adherent to certain chronic conditions, including COPD, depression, hypertension, diabetes, among other conditions. And the pharmacist provided or performed social determinant of health screenings using a 9-question survey that was based on validated screening tool that has been published by CMS. This is something that is actually publicly available. And what we found through this pilot, and that was 2 months following the intervention, was that the most prevalent social determinants of health were loneliness or isolation, food insecurity, as well as transportation. We also observed a statistically significant reduction in medical spend in all cohorts. And then we also noticed that there was impact that varied by conditions. So for example, we saw that there was a higher prevalence of social determinants of health for members that had COPD and depression. And we also saw positive medication adherence lists for COPD, depression, and osteoporosis, but we did not necessarily see that with other conditions. Something else that was also extremely important to us was making sure that we got feedback from our pharmacists that would allow us to make enhancements in future pilots. Because again, our goal is to really develop those evidence-based scalable solutions so we can be able to work with our patients to improve their health and well-being. And we got some really, really good feedback. So one was really talking about how we could offer best practices, including the best way to engage the patient to complete the screening. Because again, these are not discussions that generally pharmacists have with their patients at the retail counter. And they also wanted to know how they could use motivational interviewing to get the patients to open up about a sensitive topic. So if you think about it, some of the questions that we're asking our patients are asking about if they're lonely or if they are concerned about running out of food. And, some people are able to be open, but I will tell you that those patients that may not be as comfortable talking about that. So it's really critical to be able to utilize tools like motivational interviewing to be able to have that open, candid discussion with our patients. There's also feedback about providing client-specific resources, including a list of community resources that the pharmacist could refer their patients to. There's actually also a strong desire for pharmacists to receive education on how they could find these community resources on their own and refer the patients to those resources. The one thing that got me excited is that through this pilot, we were able to demonstrate to Humana, to the enterprise, and to others that pharmacists can be leveraged to have effective social determinant of health conversations with our patients. We always use opportunities to learn, to become better. And we use a lot of information that we gathered from that pilot to develop our second pilot with our telephonic pharmacists today. And I'd like to note that this pilot is still underway, but we have definitely gotten some good preliminary information, including the human success story I shared with you at the beginning of this presentation. And in this particular pilot, we targeted members that were non-adherent or they were at risk of non-adherence to certain chronic conditions, to certain chronic medications, and that is specifically for diabetes, hypertension, or hyperlipidemia. And the interventions we were interested in measuring this time around was both the social determinant of health screening, as well as the delivery of an adherence intervention. And what I mean by that is having a very targeted discussion about the members' adherence to the medications and understanding what barriers may lead to non-adherence or is causing non-adherence. And we were able to make a couple of enhancements that I would like to review here. So one of the things that we were very mindful was making sure that this time around we provided a proactive pharmacist network resource and training prior to launch so the pharmacists could really feel confident that they had the information to discuss with their patients as well as refer them to the necessary community resources. Also, the social determinants of health screening is being completed. And for every social need that is being identified, our pharmacists or the pharmacists are providing referrals through those that are identified through screenings. Pharmacists are also following up anywhere from 4 to 6 weeks after the initial discussion to discuss the use of the resources, as well as address any medication adherence barriers. And we believe this is a valuable piece because the patients will be able to connect the social determinant of health that they may be experiencing and how that may be interfering with their medication use, their quality of life, and their health and well-being in general. Also, the pharmacists are documenting the screening, the referrals that are provided, as well as any information they're gathering through that follow-up outreach as part of the member journey through the continuum. And the reason why this is extremely important to us is that this data will tell us what resources are most utilized, what resources are most referred, and how members engaged and are satisfied with these resources. We hope to learn a plethora of information, but I'll highlight a few that we definitely have on our radar. We want to better understand what social determinant of health prevalence that we are seeing in this particular population that may be resulting in non-adherence, and are we seeing overlap with other prevalence that we've seen in previous studies. We also want to understand member engagement, who are likely to engage, why are they likely to engage, as well as the most referred resources, as well as the most utilized resources by our patients. We're also interested in understanding the trends in medication adherence, if we see any savings from a medical and pharmacy cost perspective, as well as impacts in health utilization. So this could be things like ER or inpatient admissions. We're also gathering feedback from the members as well as pharmacists to understand what's going well, as well as what additional enhancements we can implement to make sure that these services and programs continue to be successful. So in conclusion, we believe that pharmacists have a unique value proposition in addressing social determinants of health as they know their patients and available resources in their communities. They can be able to help the payers bridge the gap by making those connections and truly understanding the social needs as well as the community resources that are really making an impact on our patients' health. We also believe that this will positively impact medication use and health outcomes of our patients and will allow us to scale evidence-based solutions and will continue to showcase the value that pharmacists bring in managing the whole person's health. Thank you, and I will open it up for questions.
All right, thank you, Lilian, for that presentation. And Jill, thank you for kicking us off. To our audience, we're now taking your questions. I have an iPad in my hand here. Your questions are being fed directly to me, so I'll read them as we go. So I want to start off with a question for both of you. We're in the midst of this COVID pandemic, and I want to get your opinion on what SDOH factors have been escalated or elevated during this pandemic that need to be addressed with priority. Lilian, do you want to go first with that?
Absolutely. So the social determinants of health we've seen are an increase in the rate of social isolation and loneliness, and we are observing this due to the distancing protocols. Something else that we have observed is an increase in food insecurity, and that is expected because patients are not able to either access the food or they're unable to afford the food. Something else that was interesting observation is also the transportation barriers, and this were in situations where the patients needed to go to their physicians for medical appointment to potentially get a new prescription or a change in prescription. So I'd say, those are really the three trends that we saw with the COVID pandemic.
Thanks, Lilian. Jill, anything to add to that?
I would totally agree with Lilian. With COVID and people, not understanding where there might be at risk with their income. There's a lot of people affected, either having to go on unemployment or work in a service industry and don't know where that next paycheck is going to come from. So there's a lot of financial insecurities in addition with COVID that we're seeing, as well as what Lilian had mentioned. Obviously, if you don't know where your income is going to come from, the concern with, food instabilities, as well as social isolation continues to increase.
All right. All right, well, thank you for those insights. We have a number of questions that are specific to the presentations you've provided us, and I want to tackle a couple of those now. And so, Jill, I'll start with a question first for you. You had mentioned in your presentation the variable of 25 miles and beyond, and that seems very interesting and quite logical. Is that a screening question, and how are those data collected?
Well, actually, I don't work with the screening type questions, but the data that we have at our access to shows that patients who live more than 25 miles from a relative would be considered socially isolated and less likely to adhere to their medications. Someone checking in on them frequently would improve their medication adherence. So I think that would be something that we might want to consider in our screenings, is to ask the question of, do you have a relative that lives nearby? Do you have a friend or an associate that you have in close contact with? Because that will help us understand if they have a support system that can really help them.
Great, thank you. Lilian, it sounds like a lot of the work that Humana is doing in this space is with in-house, phone-based pharmacists. Does Humana have any plans to expand the pilot opportunity to include community pharmacies?
Yeah, absolutely. Actually, as a matter of fact, the first pilot that I talked about was specifically utilizing community pharmacies. We're able to partner with a vendor where the pharmacist had actually access to data for those members that were eligible for the social determinants of health screenings, as well as referring them to the appropriate community resources.
All right. Lilian, I'm going to put this next question to you as well, and I'm going to let you go first with this because of your title. You have Pharmacy Stars in your title at Humana. And there's a question of, could star ratings criteria also incorporate the effort toward addressing SDOH rather than only the outcome? What are your thoughts on that?
Honestly, I think that is a great question. We have data that shows things like age, gender, low-income subsidies, disabilities inadvertently impact our members, whether it's from a medication adherence perspective or even medication safety perspective. So when we have the ability and CMS or the organizations incentivize us to continue evaluating as well as customizing our interventions to more holistically and more appropriately address those differences in social needs, I think that will be extremely critical, because again, that is something we are consistently seeing in our data, and we see just based on health disparities.
Excellent. Jill, anything to add on the potential of the star ratings program to account for SDOH, not only outcomes, but also the work that goes into identifying and addressing problems?
No, Lilian put it very well. The more information that we have about our patients, individualized to that specific person and the barriers, that is only going to improve our ability to not only improve medication adherence, but understand what barriers they have to improving their overall health. So information is valuable. We could analyze and be paralyzed by information, but having that information right at our fingertips really does help improve not only stars, but just the overall health of a patient. That's what we're here for.
I agree.
So I want to ask a question related to data. Good data, consistent data is critical to everything we do in healthcare, delivery of services, quality improvement. Do you believe that it is feasible and desirable to move towards a standardized SDOH assessment? And is that feasible given the many different ways that individuals touch the healthcare system? Jill, do you want to start with that one?
Sure, absolutely. You know, data is valuable, right? So the more data we have, the more value we can provide a patient. The key here, though, is that self-reported data. Let's face it, some patients don't want, as Lilian mentioned, don't want to share that sensitive information, and a survey, they may not want to be very honest about us or about their situations, depending on the types of questions. So the more data, a survey definitely will give us that information, and maybe partnering, as Lilian mentioned, with a third-party vendor to be able to provide broader insights can augment not only the surveys that we can implement in our community pharmacies or in our plans, but bringing some additional insights would definitely help in identifying some of the barriers. You know, we had an experience with a patient who did report on a survey and gave a home address. And when we looked at what that home address was, it was a vacant plot of land. So you want to make sure that the patient is providing honest information in those scenarios, but oftentimes I think only 4% of patients or members might return surveys. So trying to understand exactly what the key questions that we would want in our surveys is critical.
Lilian, thoughts?
Yeah, I would echo that there is a desirability to standardize a screening tool. And, you know, when I think about that, I think it allows us, one, to standardize our approach with our patients. And I think it also provides us an ability to be able to easily aggregate the data as well as analyze the data, because we realize that there's an importance to really be able to measure the impact. So I'll give you an example. So at Humana, for example, we took the opportunity to test a few screening tools, and then we ended up settling for the Accountable Health Community Screening Tool. And what we found was that this made it easier for us to consistently interact with our patients, and that it was easier for us to be able to aggregate the data as well as analyze the data. I think what is important to point out, though, is patient populations are different. We do have several well-validated tools out there. And I think for us to keep the momentum or get the momentum, I think it's an opportunity for individuals to focus on getting tools that are using validated questions and really think about what would fit the needs of their practice, what would fit the needs of their patients. And what I mean by that is, if you look at some of the surveys or some of their questions, some may be related to school or some may be related to work. But if your patient populations are retirees or children, that may not be applicable. So really thinking about which questions, which domains are important in order to address those social determinants of health. So again, I think there's a desirability, but I think it's also, we shouldn't let that slow us down. I think the focus is really thinking through those validated questions and really thinking about how they fit in the communities that our clinicians are serving.
Great, thank you. So our next question has to do with a lot of the challenges that pharmacists face on a day-to-day basis. Independent pharmacies continue to close, and many chain pharmacy organizations are cutting resources in certain ways. How do we create a business model for pharmacists to engage in these meaningful SDOH assessments and services, given the resource limitations they have, the demands for prescription services and other things that they're asked to be doing? So it's the question about the sustainable business model around SDOH screening and care. Lilian, do you want to go first with this one?
Absolutely. So what has us excited, what has me excited, is we truly believe that pharmacists play such a critical role in holistic management. And we have numerous opportunities, including the social determinants of health, to really showcase how we can maximize top of the license. And that is why we are choosing to engage in this pilot, where we're able to incentivize the pharmacists for them to screen the social determinants of health, for them to refer. And we're using that information to be able to showcase the value so we can continue investing and the pharmacists. So that's why, as I mentioned early in the presentation, having the pharmacists being prepared, having the pharmacists engaging, having the pharmacists really taking the time to follow up and close those gaps will allow us to have the evidence, the value to continue integrating the pharmacists in addressing this critical area.
Jill, your thoughts on the sustainable business model for addressing SDOH via pharmacies and pharmacists?
Well, absolutely. I think as what Lilian said, there is the pharmacists putting the tools in front of them and having them available to them. But we all know that in many community pharmacies, you have pharmacists who are very busy with just filling and dispensing, right? So do you separate the roles of pharmacists who provide these services, who do these surveys and complete the referrals, versus having just a pharmacist who fills and dispenses medications, things like that. So I think the sustainability is the wave of pharmacy, because we do provide value. This is the proof that we do provide the value and should be considered as providers of healthcare. And not just, a pharmacist filling prescriptions. But again, as Lilian mentioned, you have to have the tools. You don't want to boil the ocean on your services either. And again, think about your patient population. What are the low-hanging fruit? What is the service that you can start initiating and identify that it's shown value and has improved medication adherence and other health outcomes? Take transportation, for example. Maybe that's something that you target. Providing delivery services, those types of things. But it's definitely a sustainable model. It's just identifying in your specific pharmacy or in your organization how you want to implement and what you need to implement and what tools need to be available to your pharmacists.
That's great. All right, I have a couple more questions that are specific to the presentations. Lilian, for the pilot that you described, how long were the pharmacist or provider appointments, and how was that work integrated into the overall pharmacy workflow?
So the initial pilot that we completed was for approximately 3 months. And the idea here was that we sent clinical alerts or social determinants of health opportunities through our vendor. And we know that pharmacists generally will review for opportunities, whether it's medication adherence, whether it's statin gaps, whether it's other opportunities that they need to address with their members. So again, it's part of the workflow that pharmacists are already doing today to address medication-related needs and gaps. What we thought about here is adding that non-medical component as part of something for them to review and address with their members. Because again, the opportunities here are thinking through how we have those discussions as part of whole person health.
And Lilian, related to those specific reviews and interventions, were you able to track kind of the approximate time that a pharmacist or a pharmacy personnel staff person might spend on an individual, opportunity?
That is not something that we tracked, no.
Okay. Well, team-based care is obviously something that everyone is interested in and focused on. And this is a question that came in during the opening conversation with Laura Cranston and Dr. Jane. But it was about how can manufacturers, the life sciences companies, collaborate with health plans and others to incorporate SDOH into value-based care deliveries. So I know both of you are not, in the life sciences, companies, but from your perspectives, how do you see life sciences partnering with organizations like yours and with pharmacies to expand services in this way? Jill, do you want to take that one first?
Yeah, I'll try. So I think life sciences and pharmaceutical companies might be able to partner with, for example, I'm thinking in those scenarios where we have patients with health literacy concerns, providing tools for the particular medications or even the medical condition that would help a patient better understand maybe a video or some type of link, partnering with pharmacists to be able to provide those types of tools if that's an identified barrier. We know that pharmaceutical companies in some cases do provide some type of discount programs. So for patients who have financial concerns, that might be another opportunity to assist patients with the cost of their medications and partnering with pharmacies on those areas. Screenings might be another one, depending on like diabetes, A1C type tests or screenings. Partnering with pharmacists there are some areas I can think of that we might be able to leverage that team and that collaboration.
Yeah, I'd like to, echo what Jill said. I think there are a variety of opportunities. One could be specifically targeted to close the gaps of social needs. So we know that cost, for example, is something that impacts medication adherence, and there are, patient assistance programs that may be available, or foundations that may be available to offer assistance to this patients. I think other things to really think about is when we think about the social determinants of health, and when you think about their treatments, a lot of this are related to our communities having the resources, the staff, the funding to be able to have the food that they need or offer transportation. And so there are opportunities there to really think about how do we fund this community organizations? How do we partner with nonprofit organizations? How do we partner with local leaders that they have the funds that they need to be able to meet the needs of their community? I think something else that we found that will be critical for us to invest in, and Humana is partnering with a variety of organizations, is how do we create or how do we invest in a technology or a platform that allows for the social workers, the pharmacists, the community workers to be able to do the screening, be able to figure out what resources are available for that particular member's needs, to be able to send that referral to the nonprofit organization, and to be able to consistently track the utilization. I think that is one opportunity that, quite frankly, would require companies to invest for us to really be extremely thoughtful on creating those tools that promote efficiencies or even increasing capacity. So I think that's something else that the life sciences or pharmaceutical companies should or could consider.
It makes a lot of sense to provide, any frontline workers with those types of tools. Related to that, there was a question about training that came in. What type of training do pharmacists need to be more involved in this work? And Lilian, for the Humana program, are there specific, trainings that you guys have implemented that are kind of helping pharmacists be better capable for doing this work?
Yeah, absolutely. I think there are several components when we think about training for the pharmacist. I'd say one of the biggest component is, why are social determinants of health important? I don't know about you, but I went to pharmacy school. I don't remember, reviewing that information. And I think it's critical, right? I mean, 60% of health is impacted by social, environmental, and business needs. So I think it's important to be able to showcase why it's important for us to address the social determinants of health. I think the other component is, how do we engage our patients to have those frank discussions? How do we make them comfortable? So I talked about motivational interviewing, because again, these are sensitive topics. And that will be critical in order for us to have the right data to determine prevalence as well as referrals. I think that the component that we've realized is important is being able to accurately or better refer to the patients to the appropriate community resources that will be helpful for the patients. And I want to emphasize, a lot of this are local based or are unique to the community. So what may work for Louisiana may not necessarily work for Florida. So it's extremely important to be able to educate them on what resources are available to their patients within that community.
All right.
That's it. Those are some of the things that we have taken into consideration. You're welcome.
All right, well, thank you, Lilian. We have time for one last question. And PQA is focused on medication use quality, adherence, safety, access. I want to ask you, if you have limited resources, if you have a limited opportunity, what SDOH issues would you start with first to address SDOH and improve medication use quality? Jill, I'll let you go first with this one.
Sure, I think Lilian said it in her presentation. You need to focus on the financial assistance that patients, especially now with COVID, are really faced with, right? That could be, an area of focus. That could address food concerns, as well as transportation concerns. So those are the areas I would really start with. You probably couldn't do all three, maybe you could, but I would really start with the ones that have the highest barriers, especially in the pandemic that we're faced with. So even outside, the concerns have just grown. So I would start there.
Okay. Lilian?
Yeah, sure. And to add to what Jill said, I mean, we've evaluated a lot of social determinants of health, and as shown in my presentation, some of the most prevalent are food insecurity and social isolation and loneliness. And Humana has chosen to focus on this too because they have an impact on overall health of days. And as I discussed earlier, we know that this has an impact on members' ability either to choose to access the medication or even to adhere to the medication. We know that members will prioritize food over medicine. We know that when members have a behavioral conditions, they will not engage in taking their medication. So, if we were to select two, I'd say food insecurity and social isolation and loneliness.
Great. All right, well, we are at the end of our time for this session. Jill, Lilian, I want to thank you so much for being a part of the PQA Leadership Summit. You've given us a lot to think about as we try and think about where to focus our energy in addressing SDOH. And I also want to thank our audience for the questions that you have submitted. For questions that we weren't able to get to today, we'll try to share those with our speakers so that you can get answers to what you have asked.